Good evening. Thanks for tuning in. Senator Claire Wilson here from the 30th Legislative District. And this past session, I had the absolute privilege of guiding the legislation, better known as the Fair Start for Kids Act, across the finish line as the primary sponsor, working with Representative Tonneson in the House. What we know is that this was historic landmark legislation that made major investments in both childcare and early learning and school-age care for kids and families and providers and the industry of care across our state. It directly addresses the urgent need right now of childcare, but also what we know has been the lack of access and also issues around affordability and for all of Washington families. So today, and tonight, I guess I should say, I'm really excited to kind of take you through the information that is available on the DCYF website, particularly for Fair Start for Kids. And hopefully by the time we're done, you'll have a better idea of the legislation and the investments that are made, and also opportunity for you either as a parent or as a provider to take advantage of much of the resources and supports that were put into play through Fair Start for Kids Act. And I guess what I want to do is make sure that everybody knows how to find it. And so it's up on the webpage right now. You'll see the Washington State Department of Children, Youth, and Families Fair Start for Kids Act. But I'm going to go backwards, and I'm just going to say what happens if we Google. I have to spell it right. And you can just put in Fair Start for Kids. And what you'll see is the Fair Start for Kids Act. You click on that, and this website shows up. And on the page, because it is such a major piece of legislation, they've done a really nice job, thank you, DCYF and the IT folks, on really spelling out what is covered through the passage of the legislation and what the legislation will do. So let's just take a minute and look at that. And the reason this is so important is because it does expand eligibility for parents, especially beginning October 2021, this coming October. And if families have been not eligible for subsidy before, or how much they were making caused them the inability to pay the subsidy rate that they were shown, or the copay rate they were shown, they need to come back into the system and look to see, because they may be surprised and they may be eligible. So the Fair Start for Kids Act reduces the copays and expands eligibility for Working Connections childcare. It expands the eligibility and also the rates for our state-funded Early Childhood Education and Assistance Program, better known as ECAP, and that's our pre-K program. It expands the eligibility for enrollment for ECAP and also now Early ECAP, which is the mirror program of Early Head Start, serving birth to 3. It strengthens childcare programs by expanding services that we know are so important, especially given what we know around COVID and the pandemic and the struggles and the stresses that all families and children have dealt with. So mental health consultation, dual language supports, complex needs funds, and more. And also there is a focus on the business of the industry of care. What we know, especially because of the pandemic, is that when schools closed, people realized, I think for many the first time, that for many, school was the care setting for children, and that childcare became the care setting for so many families who needed to continue to go to work during the pandemic. So really, we know that childcare has shut down because it is a small business, and we need to bring folks back in order for economic recovery to occur. So there's dollars in Fair Start to grow recruitment and retention for the business. We expanded subsidy rates. We expanded access to healthcare insurance for providers. And we also are providing resources for professional development and scholarships. So here we go. There's some major pieces of the Fair Start for Kids Act that are really important to look for. And the first is those supports that are supporting families, and that is Working Connections childcare. And as you see, what I can tell you, as of July 1, the copays continued to be waived for families, and that's going to happen through September 31st. But as of October 1, we have a new calculation and a new copay system for families. And that there's a new, I'm going to go to the calculation because everything is right here. It's quite intuitive. And what it'll show you there is that the copay system is now going to be based on the state median income versus what was the federal poverty level. And what that means is, just for an example, for a family of 4, in order to be eligible, a family had to make $53,000 or less. And now, using the state median income, a family will be able to make $61,675 or less in 2021 to be eligible. So again, families who may not have been eligible for copays before are now eligible. The other piece, and I think that's in here and I missed, is that you'll see on the bottom of this chart that the copay is based on a tiered system now, and that you will see from a zero copay up to $115 copay, up beyond to $215 copay for families. And the copay subsidized will pay, it'll change over the coming years, and we'll continue to increase families that are eligible. But no longer will you see someone having to go from a $65 copay to a $500 copay, which was the cliffs that we heard so much about. So we now have tiering happening within our Working Connections childcare system, which is really exciting and I think will really be helpful. So again, please come back into the system to find out whether you might be eligible. As I said earlier, DCYF is switching from the federal poverty level to using the state median income. And the income eligibility, as I stated earlier, at 60% is $60,674. And it'll continually, gradually increase over the years. And then as we go down, all of these are quite intuitive. So just do a click and it'll give you information. The copay structure, as I said, will begin to cap at $115 once copays are collected again starting October 1st. And for households at 60% of SMI, copays are capped at $115. For households that are at or below 50%, they're capped at $90. Again, we have a tiered system of support for families. So you don't go from nothing to a place where you have to decide whether you can either not accept a job or a promotion, perhaps, if it means increased pay. The next thing, exciting piece is Working Connections for student parents. And we expanded that to say that full-time students enrolled in voc ed programs at either a community, technical, or tribal college that leads to an associate degree or apprenticeship programs, that the work requirement will be waived for families. And that began July 1, 21. And the hope in my mind is that we will continue to think about how we're providing opportunities for parents who are back in the education system to get degrees that allow them really to make living wage jobs. You'll see down on the webpage also, they did a really nice job. If there's information that is more in depth, you'll see red here. So for example, for more information, visit our Working Connections childcare page, and it takes you right to the page where it talks about the copay calculations. It gives you the subsidy rate regional map for the family childcare homes and centers. It talks about eligibility requirements. Again, very intuitive and very much a one-stop shop for everything you might need to know about not only the Fair Start for Kids Act, but all of those systems, services, supports, and resources that are connected to them that are impacted by this. Next thing we're going to look at is the Early Childhood Education and Assistance Program expansion, and that would be ECAP. And again, we're going to click on down, and we'll see that beginning the 22-23 school year, we have an expansion of eligibility. We also have automatic eligibility for families experiencing homelessness. And we also have eligibility, so we make sure that there's continuity of care. If children are in a program in a birth to 3 setting, whether it's early Head Start, ECIT programs, developmental childcare program, early ECAP, or Eclipse, if they're on an IEP, or if they are Indian, as identified by a definition that'll be created between DCYF in agreement with tribes, so that, again, we have automatic eligibility. And as of July 2026, all children who are eligible for ECAP through these methods will be entitled to be enrolled in the program. So we are moving for automatic eligibility. And this eligibility has been pushed out. Entitlement has been pushed out. But we have expanded families that are eligible for ECAP. And again, not all families need or want comprehensive service, and our programs are based on income, based on age, and also based on need. The expanded enrollment and early entry, beginning the 22-23 school year, when a child's not eligible for ECAP, they may be allowed to be enrolled in the program if space is available. There again are some income eligibility factors here. And again, we're looking at particular needs of families. And there are priority points given based on risk factors and family needs in order to look at how we can expand access, especially if there are programs across the state that are not full but have children who may benefit and families who may benefit from the service but may be a bit over income eligibility. I talked a little bit about that, but within that legislation is also the conversation between Washington's tribal nations and the ECAP staff to develop a definition of Indian child, so that we have consistency across the state, across programs to use as eligibility purposes. And once there's this definition, it'll be added to the WACs for DCYF. Again, if you have more questions around ECAP, Head Start, early ECAP, or early Head Start, a wonderful link at the very bottom, and talks a bit about the programs, the types of environments, a little bit about eligibility for each program, enrollment requirements, and again, a bit more about early care and education settings for children and choices in our state. So if we go back, next thing is, where did I stop? You see, even I get mixed up. Okay, here we go. So for providers, if you are a provider of ECAP services, you'll be happy to see an increase in rates. And there's a 10% slot rate increase in started, that is beginning contracts for July 2021. So you should have received or should be receiving those. And then again in 2022, the next year, you'll receive an additional 2 to 3% slot rate increase. Again, ECAP program page, if there's information that individuals who are looking at this webpage want to know more about. This is a really exciting piece. This is around the additional supports and that were inside Fair Start for Kids related to really resources that we know and services that we know are so urgently needed by providers across the state on behalf of kids and families. And so the first one that you'll see is the Infant and Childhood Mental Health Consultation Expansion. And that started it will start October 1. And what that is doing is adding 6 more infant and early childhood mental health consultants across the state. And you'll see again, for more information, it'll take you to the Childcare Aware website. And the Childcare Aware is the organization that provides the infant childhood mental health consultation to early achievers, participants, and also to the families they serve. So if you want to know more about that, you just click on that link and it'll take you right there. It's a very important one, and we know especially as kids are coming back into school and children coming back into care, if families are going back to work, this is going to be critically important. Another thing that we know is that professional development is critically important. And although we all have a set of skills that we have mastered in the world of early learning, that there's always things that we need to continue to hone as far as our own skills on or learn more about. I think about adverse childhood experiences. I think about things like trauma-informed care. I think about things like our work around equity and access. And so although we come with a set of skills and knowledge, it's important to make sure we continue and maintain that knowledge. And so oftentimes in the past that's done, but there's not been support, especially for providers, to continue that. So what we were able to do is increase supports for scholarships and expand the eligibility there, and also really focused on implementing community-based pathways for those education requirements. And we've heard over and over again, in particular in those areas of the state that are more rural or more geographically, I think, further away from where sometimes core services and where educational entities are coming, that there's got to be other ways of doing that, and how do we build on some expertise or the opportunities within communities. And I do believe that, again, this pandemic has given us this opportunity as we think about how we've had to flip to online learning in so many ways, and how do we use those platforms and those abilities, or how do we use our telehealth systems to really think about how we not only provide professional development, but also coach and also provide opportunity for learning. So again, professional development, increased resources. And again, if we click on the professional development site, talks a lot about the updates. It talks about community-based training model, and then talks a lot about the resources, as well as things like the merit registry, substitute pool, workforce development, and such. So this is a site that is going to lead you on to other things that you may have questions about and you didn't really know where to go or where to look. Another really exciting piece is the sponsorship of childcare workers through the Washington State Health Benefit Exchange. And there are healthcare navigators that will help individuals in the childcare profession access affordable healthcare using the Health Benefits Exchange. And while that is not solving the issue of how we're supporting health care, retirement, and salaries, if you will, of the industry, it is a beginning to help an industry that has cared for kids, especially thinking this last year and a half, and the majority don't have health care and aren't eligible for that. So really felt like we needed to do something, although we're not done. The next part is grants and rate enhancements. And there's a number of dollars that will be available, some immediately and some will be rolled out. As you can see, this legislation is huge and there are many pieces and many moving parts. Some of that will be done directly through DCYF. Others will be provided through RFPs or through organizations out in communities to provide pieces of this legislation. So this will be a site you want to continue to come back to find out more. And as we get further down, you'll see some of those places where it's in progress or come back for more information. So the grants and rate enhancements, complex needs funds, we've got funding available to really support children that we know oftentimes have additional needs or needs additional supports, whether it's because of developmental delays, disabilities, or whether complex trauma, whether there's challenging behaviors. We know this. What we also know is we have young children that are being suspended and expelled from childcare and from early learning settings, and that should just never, ever be. We have got to provide supports to the children, to the providers, and also to the family. So the Complex Need Funds aims to support that and to support the developmental and learning gaps by providing additional dollars and also support to providers. So watch for the Complex Needs Funds to roll out. Trauma-informed care, and I do believe that Complex Needs Fund, currently there is a system that is in place already for our state and federally funded pre-K programs to access. And there is a system being created right now for childcare and for others because that has not been in play. Trauma-informed care supports, and again, that is being developed on what that means and what that will look like, but it could include compensation for things like hiring individuals that have credentials, particular training, specialized training that can provide support services. It could be involved if a site or a center or staffs want to use some particular screening or assessments tools to help them. So it's really dollars available to think about all the different ways we can support. Dual language rate enhancement. It is establishing a designation for this enhancement. And also, I do believe, site-specific grants that would bring additional dollars to centers who were either providing dual language or had staff that had that specific skill. And it could, again, be used for additional dollars to compensate staff. It could be used for additional training, for curricula, or also for materials. But the establishment of the process and for the rate enhancement is happening. The equity grants, another important thing as we think about children and communities furthest from opportunity. We want to make sure that we are supporting inclusive and culturally relevant, culturally respectful, and also linguistically specific early learning and childcare programs, not only for kids, but also for their families across the state. So equity grants will be available, and they will be available every 2 years, and so you could reapply. And again, the process will be created and dollars available. And then infant rate enhancements. We know that the care for infants is more than the cost of in-state college tuition. And so we have got to figure out a way where we can incentivize the care of infants and toddlers, for oftentimes our preschoolers and our school-aged children can bring more dollars in. And because of that, we have less space and less opportunity for infants and toddlers. But we have an incredible need for families to know that their birth to 3 children are safe within someone's care if they don't have a family friend or someone at home to do that. So as you'll see here, it says check back often for more details about the rollout of these funds, including how to provide feedback on their design. So all of these will be designed with support from ELAC and also, again, from providers and stakeholders across the state. So keep your eyes open on that. Childcare licensing, we've got expanded resources and support, an organizational license pilots project. And this is kind of an interesting thing, and I know enough to get myself in trouble and not enough to do any more than that. But it's really thinking about what kind of a pilot that DCYF could run that would allow a childcare category licensing for multi-site programs under one owner or entity. So childcare, there'll be newer existing licensed childcare providers can participate, and it will, you need to come and look at the webpage if you're interested in the pilot. You will see that if you're interested, there's an email of the individual. You can email to find out more about this. And the recommendations from the pilot would occur, come to the legislature in 2024. So this is something that I believe is happening now. Another thing that's really important as we look at just the pandemic and economic recovery is employer-supported childcare. And we continue to have a conversation about the role that business plays in childcare and how it is that we support business or business support families when we look at how it is that we care for children. And it doesn't always mean that an industry or a business would have a childcare facility on site, although that might be if you've got a large industry or a large facility. But it's also what role we could play and each other could play in supporting, whether it's financing, whether it's providing dollars, whether it's providing a site, whether it's sponsoring, a certain number of contracted slots, if you will, for an industry in a nearby setting, whether it is making sure that through the HR process when employees are hired, there is, active marketing around supports for families and with children. So really needing to work together between DCYF and the Department of Commerce to really provide technical assistance to employers to think outside the box and inside the box about how they can support access to high quality childcare. And an example I would give would be during the pandemic, I was talking with a large industry that makes airplanes, and they have a contract with childcare providers, a center that provides birth to 5 services. But when they were interested in bringing employees back to work initially, and schools were still closed, they didn't realize that families couldn't come back unless there were places for those school-age children to be. And so it really opened up their eyes about the role that they play in really thinking about not only our birth to 5 space, although that's critically important because kids are not in school yet, but also what is the role of an employer in supporting? Because if a family or an employee knows that their children is safe within someone's care, they can focus on their work. And we know too often that's not the case. And then we have employees that may not be able to give their 100%. Early learning facilities, and those are dollars coming out of the Department of Commerce. And it's not only grants, but also revolving loan fund. And there's kind of 3 areas of project awards. One is major construction and renovation, and that's up to $1 million. The other is minor renovation and pre-development, really kind of thinking about either how do I renovate my space right now to make it even better or more user-friendly or safer or whatever, but also what is it that I might need to do if I'm thinking about developing something or purchasing something, and then pre-design. How can I start to plan and help? So grants can be used for construction, renovation, purchase, as long as the grant results in an increased number of early learning spaces. There is also in the early learning facilities program a commitment to reserving spots for both our state funded pre-K program and also our subsidy programs, so that again we're making sure we continue to think about serving families who are furthest often from opportunity and least able to afford the full cost of care. And eligible grant applicants include all kinds. So family child care centers, community technical colleges, ESDs, governments, tribes, religious organizations, housing developers, which would be awesome. Build a child care center on the first floor and housing above. Projects already completed are not eligible to apply. And there must be a commitment to maintain an early learning facility for 10 years if you do get the dollars. Again, there's way more information around not only the technical assistance, but also more about the program itself right here on the website. So that is around early learning facilities. So let's go and look at our birth to 3 or strengthening prenatal to 3 supports. Lots of things happening here. And we know, again, babies don't come with directions, and families aren't around in the same way they used to be. And as we think about supports right now, especially with the pandemic, I know there's a lot of families in need. So the home visiting is one that is through Fair Start for Kids. We're going to be able to expand home visiting services, and also going to make recommendations to the legislature around how we continue to strategize in supporting providing home visiting services and home visiting, and really enhancing the way we're collecting information in order for us to be able to continue and also expand. Because it's a service, I think, that oftentimes is mistaken as one that's one of invasion as opposed to one of support. And it's really around how it is that we support families in being confident and feeling capable, and knowing there's someone there in case they need help. So I am going to say here is our home visiting site, and talks a bit about the program, that it is a voluntary program, and expansion opportunities, and a bit more about the home visiting advisory committee that does exist to look at what's happening in the state. Okay, here we go. Eclipse Expansion. So there is, this is better known as therapeutic services and therapeutic care and treatment for children. And there is expansion, and the intention of that expansion is to serve geographic areas that are not currently being served by Eclipse services. And those furthest from opportunity, to make sure that, again, we're putting supports where we need them first, and then expanding supports in areas that might already have some. And if you visit the Eclipse program, it's really early childhood intervention and prevention services. And again, it really meets the needs of infants, toddlers, and preschool children, birth through 5, who many of them have been impacted by adverse childhood experiences. And there's a support on really supporting the complex trauma that comes to oftentimes with children And so it's a great program, again, birth to 5 expansion. And again, looking at geography about where we don't have services now, so that we can expand that and touch more families. Family, friends, and neighbors, FF&N, play and learn groups, and funding was provided to expand play and learn groups, because we know the majority of families still have children at home that are being cared for by an aunt, an uncle, a grandma, a significant other, a neighbor, as opposed to in a formal care setting. And so we expanded the funding here. We heard from caregivers how much they appreciated that support and that ability to help them with isolation, and also social emotional support, and ways that they can promote kindergarten readiness in their homes as they are caring for young children. And excited that we're going to be able to continue to see that program grow. Early ECAP, we were able to move from a pilot into legislation. And early ECAP, it's a center-based program for birth to 3. It is mirrored after the federal Early Head Start program. And we are allotting $3.2 million to expand early ECAP services. And you can click on that link and find a little bit more out about what early ECAP is. And again, early ECAP, Head Start, Early Head Start are comprehensive preschool programs and early care and intervention programs, and are provided across our state to families based on child's age, family income, and risk. Next piece is data and accountability. We all want to know, so tell us how come, tell us the who, give us some demographics, and talk about the why. And then I want to know how we're spending the money to make sure that we're not being wasteful and that it's being used where it should be. So DCYF will be developing regional dashboards and reports, and I will show you that there is already a dashboard information where if we can look at legislative district, and I will go to the 30th here, and we're looking at all age groups. And it's hard to do this on, but what it will do is tell you that in the 30th legislative district, that for all children, there is only 30% of the need, estimated need is met, that we are serving just under 2,000 children and have almost 100 eligible children not being served. And if we looked at the infant toddler data, we would see that we have an estimated need of 17%. We're serving 630 children, and we have 3,749 eligible. So this, again, is the dashboard, and you can play around with that in where you live by age and kind of see what's available. But again, that will help you understand and others understand, I think, kind of where the scenario is and where services and supports are. The Integrated Early Learning Report, it is a collaboration between OSPI and DCYF to think about recommendations for aligning and integrating high quality early learning programs. And September 23 is when the report is due. And when we think about integrated early learning, we're thinking about those programs that sit within DCYF, whether it's ECAP, whether it's Head Start, whether it's ECAP, Eclipse, whether it's childcare, child welfare, and then those that sit in OSPI, developmental pre-K, transitional kindergarten. How are we, and early childhood special ed, how are we working together? How are we aligning for children across both systems and sectors? And funds come from both systems and sectors very separately. But nonetheless, there needs to be a continuum of care, and we need to serve as many families as we can. On the Early Learning Advisory Council, I think this is really an important addition that in the Fair Start for Kids Act, we have really expanded the purview of ELAC and have asked them to provide guidance on the Fair Start for Kids account, which is where the dollars will be distributed from. And because of that, we've also, excuse me, expanded the membership. And within that new purview, expanded purview, there's also a subgroup we've asked to get together to really look at licensing and put together a temporary subcommittee to thinking, again, looking at licensing, looking at alignment, looking at simplification, and understanding that quality comes first, but we also know there may be some areas where there's duplication or where we may be able to make some modification or changes, and really looking forward to what that subcommittee comes up with. Again, ELAC working with DCYF to make sure that we, all of us, not only legislatively, but also stakeholders and families are aware of the implementation. Because again, within this Fair Start for Kids Act, there are dates of implementation that go through 2026. So it's just not 2021, 2022, 2023, it's ongoing. And it really is the roadmap as we look forward for how we're creating a system of and a continuum of care for children and families prior and really after they cross that kindergarten door. So there will be ongoing report in 2022 on the phased implementation. And then in 2023, we'll be looking for a biennial report to really describe to not only the governor, but the legislature on how the investment of funds have impacted the objectives we've looked for. And I'm excited about those outcomes because I know once folks are resourced and once we have resources, we actually may reach the outcomes we're looking for. Again, there is a page that specifically goes to ELAC, and I'll just tell you right up top, there's recruitment open. We have new spaces available, and please, please, please look to see whether A, if you may be interested, and B, whether you may fit one of the categories, and please consider applying again, it will tell you a bit about who the members are, when the meetings are, and such, but would love to have involvement in the, of those individuals that might be interested. A little plug for ELAC. And then the only other thing methodology-wise is that there will be a methodology identified at the school district level where DCYF will look at kind of geography and where ECAP slots are needed. And I will say, being an old ECAP administrator, we used to have something called the saturation study. And the saturation study was what the saturation study was what was created to look at where slots might be. And I think this is similar to that. Okay. Anyway, so we'll wait to see what DCYF has to say. Did I do something? I think I messed up. Hang on. Oh, am I back on? Whew. I think I lost you back. I am so sorry, you all. This is new for me. I was talking about the methodology, but basically, the state DCYF has to come up with a way to determine where states or where ECAP slots need to be across the state, and where there's greatest need. Check back for details on this one. So we have hit the bottom, and what you'll see is there's lots of information on all kinds of things dealing with early learning and early care and education. And the one we focused on tonight was Fair Start for Kids Act. And I hope that kind of walking through the webpage was helpful, because I think it's quite intuitive, meaning you can't really get lost. I think that it also takes you to other pages where you can get that further information, actual applications, actual dates, actual contact. And I think what's really important is that as this legislation goes into effect, that more and more families may be eligible for resources that they have either not accessed prior to this because they've not needed it, or again, as I said earlier, they tried to access it, but because of their situation and because of our eligibility requirements, were not eligible. So if you are a provider, please, please, please reach out to families who have reached out to you in the past or families that have left. If you are someone who works with families in the community, please, please, please share information. Childcare Aware Washington, Childcare Resources, Fair Start for Kids webpage will give you a start and a place to send families to see, because more families are eligible, and families need to know that they can access these programs. In the past, I think all supports for families, and especially as we look at childcare and ECAP, were looked at as poverty programs because only those families furthest from opportunity were seen as needing it. And I know that we know that's changed, that all families need support. And some families need support and resources. Some families need support and a little resource, and some people just need the resource. They can support themselves. So seeing this webpage full circle, knowing that we have made changes that will touch not only families and children, but the industry, starting July 1, and as we move forward for the next number of years, couldn't feel better and couldn't be better. And no one would have thought, as we started the work on this, that we would be in the situation where now more than ever before, we have an urgent need to support all children and all families to make sure that they're happy and that they're healthy and that they're safe, and that we as a state and as a country lift up and support those that need support. And I think that's all of us. If you can think of any families that might qualify, please, please, please make sure you share the information about Fair Start for Kids. We will be taking the link from this live recording and passing it on and putting it on my Facebook page and other media. Would ask you please to do the same. And if you've got any other questions about this program, any ideas about legislation, My info is going to come up on this next closing slide, and please feel free to reach out. And I just want to say thank you so much for those that are watching that are making sure our children's spirits are safe within your care. And if you're a family looking for care, please know we've got an amazing system of not only quality but caring individuals across our state who are waiting to serve you and to serve your children. So thank you so much for being here tonight, and take care and have a good night.